Hello, this is Anjali Rawat, working as HOD nursing at Sukoon Health. It's been 15 years in nursing services and hospital administration with a wide range of work involving clinical practices, education, administration, operational efficiency, quality, and process improvement. Sukoon became part of life when I deep dived into the founder's intent to do exceptionally good in the field of mental health, and nurses can be very instrumental in bringing that thought to reality by actions. My role mostly revolves around taking care of people who in turn take care of our patients, to build a support system for staff members so that they can deliver the best of care to best of their ability with compassion and dignity. I am more focused on building a team Sukoon spirit. Nurses work in shifts and care is continued through handovers. Nurses start their shifts by nursing prayer for their patients. They then check their patient assignments, meeting and greeting patients, attending rounds, making contribution to the discussion, carrying out care required or planned for the day. Admission at Sukoon Gurgaon can be either elective, where a patient visits OPD and is advised admission for further care, or through emergency. In case of elective admission, the patient is accompanied by an IPD coordinator to the ward. In case of emergency, a patient is first attended in ER and then accompanied by staff to the ward. Patient is made aware of the surroundings. One staff is present alongside the patient and a schedule is provided for the day. Most of the personal belongings are handed over to family members and only essentials which may be required are provided to the patients in agreement with the clinicians. At the time of discharge, medications and follow-up are explained and patient belongings, if any, are handed over. At rehab facility, we only take elective, well-planned admissions. Patient safety is our topmost priority. We have taken all measures to minimize potential harm. We ensure that one staff member is alongside the patient. Continuous staff training and sensitization regarding potential harm and access control wards. There is also camera surveillance all over the facility. There are multiple examples of difficult situations arising in patient care areas, like patient being aggressive, not being able to accept reality, is verbally or physically abusive, or wanting to run away from the place. The nurse understands that this is not their behavior in reality and they need help. So nurses try many mechanisms like listening, bargaining, de-escalating, or therapeutic touch, or at times it may need pharmacological management too, which is done with the clinical team. We have a feedback form which patient fills at the time of discharge, through which they can either appreciate or raise concerns. We also have feedback cards on which they write about their experiences. Also, during rounds, a non-formal feedback happens about nursing services, and I take pride in stating that most of the patients and family rate their satisfaction with nursing services from very good to excellent. Hence, I feel privileged to lead such a team.